So hi, I'm here with Dr. Siddarth Sethi, Gastroenterologist and Hepatologist. And in this video tutorial, we're going to be looking at the role of a gastroenterologist and the role of a hepatologist in the medico-legal setting. So specifically, when would you as a referrer call on the expert medical advice of a gastroenterologist and a hepatologist? So welcome, Dr. Sethi.
Thank you, Sue. Thanks for inviting me to speak today.
You're welcome. So where should we use a gastroenterologist and a hepatologist like you?
So one could refer patients to me for a broad range of gastroenterological or hepatological conditions, including, so basically I cover the entire gastrointestinal tract from the mouth to the back passage. So any stomach or bowel issue. I also cover liver issues as well. So classically, someone may have developed liver disease. They may claim it's related to medications they've taken for an alleged work injury. I would then be invited to assess and comment on that. But I must say the majority of my work is essentially gastroenterological rather than hepatological. So I'm a gastroenterologist and hepatologist. I assess a broad range of gastroenterological and hepatological conditions. So that includes the stomach, bowel, and liver. So the gastrointestinal tract extends from the mouth to the back passage. So classically, I'd see patients with reflux, abdominal pain, or irregular bowel habits. So from a plaintiff's perspective, if a patient has developed gastroenterological symptoms after a work injury or related to medications taken for the work injury or treatment, I would then be invited to perform an independent medical examination on such a patient. And if required, I can perform AMA5 impairment assessments as well in order to help to fully assess the claim. So I would often see patients who've had back pain, obviously not in relation to the back pain itself, but in relation to analgesic medications such as tramadol, Nurofen, non-steroidals, or any analgesics they've taken for the back pain. They commonly can cause gastrointestinal symptoms such as abdominal pain, stomach ulceration, or constipation. I would then assess that. I will routinely perform a medication review and assess as to whether the medications the patients have been prescribed are contributing or causing their symptoms.
And are you ever asked to comment on medical negligence issues?
Yes, I am. I've done a broad range of medical negligence work, both from the perspective of the plaintiff as well as the defendant. So my role on medical negligence matters is to assess the matter involved. So look, medical negligence cases are often quite complex, but I'm certainly happy to perform them.
And what kind of cases would present commonly with medical negligence? So
a classical presentation would be someone who had been, say, received treatment in a hospital or by another medical professional, where the treatment did not have the desired outcome. So my role would be, from a plaintiff perspective, to assess whether negligence did occur, and if it did occur, what was the outcome or the consequences. From a defendant's perspective, I would examine the case and also assess whether or not a negligence did occur, and if it was, I would examine through the issues in a scientific and in a comprehensive manner to see what went wrong. So there is so medical negligence can be done by interviewing the patients. It's often done on the basis of file reviews as well. So often I'll be sent often thousands of pages of files. It'll be my job to sort through that and work out what went on. So in a sense, it's like forensic accounting in a sense.
They're always the big files, aren't they?
Yes. After medical negligence work, I've done on behalf of plaintiffs, lawyers. I've done it on behalf of the government as well as a defendant. So I've worked on medical negligence from both sides.
Sure. So thank you, Dr. Sethi, for sharing your expertise with us today. Dr. Sethi can, of course, be contacted to provide his expert medical opinion on any of these kinds of matters, from medication to medication review, IMEs, file reviews, impairment assessments, medical negligence, and more. So if you would like to get in contact with Dr. Sethi, and if you would like to book him for any of these kinds of service referrals, please feel free to contact him using the details on the screen. Thank you, Dr. Sethi. Thanks for your time.
Thanks, Sue.